This is Dr. Blue, and I just want to show you a little bit about what this technique of upper cervical care is all about, the specific nature of the imaging that we take and the way we look at it and analyze and diagnose specific upper cervical problems and subluxations or misalignments that could be inhibiting your body ability to heal, to function, just to work the way that you would like for it to work. So this type of imaging that we have here at Blue Spinal Care is a cone beam CT imaging. We take these images. I do refer my patients to a dental facility so that way they can get this quality image, 3D imaging, and almost just like getting basically a ultrasound or CT of the cervical spine itself. So if you look here, the images here is a person looking to the right. Here we can see some really good clarity in these images that you can't get on digital x-ray or plain film x-ray. But this type of technology and imaging allows me to be able to assess the cervical spine in various different angles and perspectives, just so I can see this junction between the skull and the top bone in your spine, the atlas, and see the misalignment or see any type of abnormalities or anomalies, see how the spine is twisted down below the base of the skull. Here we're looking at the center of the skull here, and then we're coming down, drawing a kind of an eyeball line, if you will, to see that the vertebrae here are basically off center with one another. That's one of the things that we look at. Another thing we're looking for also, of course, is your bone cancers, your fractures, any of those red flag things that would signify a person's need to seek emergency care other than my care here at Blue Spinal Care. So as I move the images around, you can see the detail and the clarity of all the joints in between each vertebra that we look at and measure these angles very carefully, making sure that we're getting the exact measurements for that person and individualizing each correction that we make on either cervical vertebra that is catered specifically for that individual. This type of imaging allows me to be able to do that. So I can look at both sides, from the front, from the back. I can even look from the top down, looking straight down through the skull itself, looking at the alignment of the vertebrae. As I zoom in here, you can see the atlas here, the first bone, and then you can see it steps down to 2 and to 3. And we're looking for just kind of how you notice how more space is over here than is over here, or more space is here than here. That is signifying down below what we saw here in this image, the spine being twisted and causing a deviation in the alignment of the vertebra. So that's a very good aspect to be able to have. And there's a lot more that we do with this, and I won't go over today, but cropping out specific areas to be able to really get down to just the bare knuckles of the misalignment itself. We also have another aspect that we look at when we're judging the atlas. So this is the bone here, and so we're looking at how your skull sits right in these two areas of the top bone in your neck. This sits right underneath your skull, and then this is C2 that sits right underneath that. So a little bit of anatomy here. Your skull sits right on top of this top bone, and that gives it the ability to rock back and forth, basically to say yes and no. Well, then your head pivots into the no by rotating on this bone here, the axis, just like the earth rotates on this axis. That's how that got its name, because the top bone and the skull rotates on that. This bone is the atlas, just like that Greek figure, the atlas holding up the world. We say that this is holding up your world, your skull, your brain. And then through that space there is where the brainstem goes through. So just the slightest misalignment, 0.5 millimeters, is enough to cause neurological interference as well as postural deviations. So now that we got that, I'm going to show you exactly how I look at that arc there where the skull is sitting in there and looking at the edge all the way around to see the misalignment down to 0.1 of a millimeter, if you will. So we're going to do that on the next imaging. So what I'm doing now is I'm basically going to crop away the skull itself and get right down to looking at basically the atlas only. Right here. This is an outline of the atlas here. I'm going to clear up the image a little bit, and then we're going to see it come into a little bit clearer focus right there. And it's this outer edge that I'm going to be looking at by taking a cropping tool and an arc tool to trace that outer edge so I can get a better picture. There we go, right around there. And now I'm going to isolate the image to where now this is what we're going to be looking at. This bump here and this bone is the axis right here. This bump here is the atlas. That bump there, we're looking at it straight from the side. So my arc is here, so I'm going to travel around the arc looking for the skull to form and the atlas to form, and looking for their alignment with one another. So as I move that picture, I start to see here, this is the skull. This is the base of her skull. This is the atlas. So we're looking at it at an angle now. We're looking at it at an angle to see these edges, this edge and this edge, and see how they're lined up. So let me darken the image up so we can see a little more clear. So there we go. At this particular point, these edges are lined up. That's what we're looking for. Let's see if that continues. Go through, and it continues, and it's lined up all the way out. So now I'm going to go back to the center and see if there's any difference in the other side. So as I go around, we start to see the edges come up, and then we start to notice, uh-oh, this edge is here, this edge is here. They're not lined up like the other side. It's very, very faint. And as I said before, it only takes 0.5, a half a millimeter of movement of that bone to start a neurological interference and start your body from not functioning to its best of its ability. So I'm going to measure and see exactly what we're dealing with here. I'm looking at 0.8 millimeters of a misalignment. And that's enough. That's just with C1. We won't go into the analysis of C2 yet, but just looking at C1 today lets me know exactly how that bone is misaligned. I measured it all, and now I just need to do some more analysis and checks to see if everything that I'm seeing here is confirmed with the body and the indicators that I'm looking for. The next step would be to go and correct that misalignment and get her body functioning better.